You can call the meeting to order, Mr. Chair.
Good morning. Good afternoon, everyone. The date, we are today on Thursday, January 12th, 2023. We are convening our first of the year meeting of the Strategy Committee meeting of Access Health Connecticut. We now call this meeting to order. I would ask that each of you introduce yourselves, and I guess, Marcin, if you could do a roll call to determine whether we have a quorum, and then we can proceed from there.
Yes, Mr. Chair. Steven Hernandez.
Present.
Grant Rader.
Here.
Paul Philpott. Paul Lombardo.
Here.
CC Woods. Matthew Brackman. And Theodore Doolittle.
Here.
Thank you. We do have a quorum, Mr. Chair.
Thank you so much. And may I ask now the staff of Access Health Connecticut to introduce themselves as well?
Sure. James Michelle, Access Health Connecticut.
Daryl Jones, Director of Finance, Access Health Connecticut.
Rebecca McClear, Director of Technical Operations and Analytics with Access Health.
Susan Rich-By, Director of Legal Affairs and Governmental Affairs, Access Health Connecticut.
John Carbone, Director of Small Group and Product Development.
Good afternoon, Glenn Jurgen, Director of Human Resources with Access Health Connecticut.
Tammy Hendricks, Director of Health Equity and Outreach, Access Health Connecticut.
Gina Walsh, Director of Operations, Access Health Connecticut.
Marcin Olszewski, Governance Specialist, Access Health Connecticut.
That's great, everyone. Thank you so much. And last but not least, did you introduce yourself, Mr. CEO?
Yes, I did. I started.
Okay, good. Right.
Thank you.
Well, good. Well, thank you all. And Marcin, as you noted, there is no public comment for the record.
That's correct.
I think now, if we may, why don't we move to having a motion and acceptance of the meeting minutes? Is that right, Marcin?
That's correct. To approve the September 8th, 2022 Strategy Committee regular meeting minutes.
That's right. Can we have a motion, please, from one of our colleagues?
Motion to approve. This is Grant.
Any seconds? I will second, Marcin, if that's appropriate.
I believe it is, but I would defer to our legal counsel. Is that okay for the chair to second?
Well, I think because he called for the motion, if we have someone else to second. Ted, are you there?
This is Paul Lombardo. I get confused on when I can vote and when I can't vote. If I can vote, I'll second it.
Yes, you can vote, Mr. Lombardo, today.
Okay, thanks.
Thanks,
Thank
Paul.
you.
Yeah.
Thank you.
Thank you. If we could have a roll call, Marcin.
Is there a discussion, Mr. Chair?
Oh, any
on
discussion?
Yeah.
Hearing none, if we could have a roll call.
Sure. Steven Hernandez.
Yeah.
Grant Rader.
Yes.
Paul Philpott. Paul Lombardo.
Yes.
CC Woods. Matthew Brackman. Theodore Doolittle.
Abstain.
Thank you.
Thank you, Marcin. And I know that we have a robust series of presentations, so I turn it again to you, Mr. CEO.
Thank you, Mr. Chairman. We thought that we would give you a preview of open enrollment. As you know, this Sunday is the last day of open enrollment, and we will have a summary presentation for the board next Thursday. But we will have a full presentation for the board at the February board meeting. So this morning I'm going to introduce Rebecca McClear. Rebecca replaced Rob Blundo last year. So she's going to give a brief update of where we are with open enrollment with both QHP as well as dental plans. Again, this is very high level, and more detail to come next week, even further details on at the February board meeting. Rebecca?
Thank you, James. As James mentioned, with a quick high level view, we share this information internally every couple of weeks. So if you reshare it with the group here, as always, if there's any questions, please let me know. The information in this report is as of the end of December. So the numbers are a little bit better a couple weeks into January here, but just to give you a heads up. So as of the end of December, we had enrolled roughly 103,000 individuals for a 2023 medical policy. That's really good. Our forecasted numbers for our open enrollment period is 108,000. So we are on pace to meet that goal. And so that's a good sign. Additionally, we have had 7,000 individuals that had also purchased a standalone dental policy for 2023 through our system. For reference, this was the first year that we integrated the enrollment of the dental or shopping and enrollment of the dental policy into the same platform as medical. So last year at this point, we had just over 4,000 individuals in a dental policy, and at this point we had 7,000. So we are exceeding where we were. We also exceeded our goal, which was 5,000 enrollees. So we're pretty excited about the dental program there. Website traffic again continues to be strong. We've had over 900,000 visitors to the website since the beginning of open enrollment. Is slightly higher than last year at that point, but again continues to be strong. Also, just so that folks are aware, I did include our statistics to our call center, where folks can call if they need assistance, either enrolling or reporting a change. We do see that the call volume overall year over year is less. So one of the things we've done over the past year, and we continue to do, is strive to allow folks to self-service as much as possible within the application. So we do look to see that call volume is going in the right direction. There are a lot of things that folks now can do on their own. They don't need to call our call center for help. I will say that the next section there are in person. We have folks available to help the consumers throughout the state, throughout open enrollment. I do say here, we had 6 open enrollment fairs, but I do believe there were a number in the last couple of weeks, as well in this final push. I believe we're up to 21 enrollment fairs will have been conducted by the end of this week. So that's all over the state, a great resource for the residents of Connecticut to get face-to-face help if they need that. And then finally, our last push over the last week, we have done direct mail and outreach to roughly 8,500 households that had yet to renew their 2023 coverage. We all know there's a number of reasons folks may not renew their coverage, but we do want to make sure that folks are aware that open enrollment will end the 15th, and they do need to enroll for the plan if they wish to have coverage for 2023. So we are doing that outreach to them via direct mail. Next slide. Thank you. And then on this slide, I won't go through it all, but you can see we just kind of give a comparison year over year. The breakdown for the QHP members, new customers, so the acquisition, folks that did not have QHP coverage with us at all in 2022, but now enrolled for 2023. And then the retention is, again, folks that had it in 2022 and kept for 2023. We do see a decrease there, and there are always a number of reasons. Folks got coverage through an employer, the economy is a little bit better. Folks going on to Husky, and again, that population of folks that haven't come back to renew yet. What are the other ones I wanted to point out? Just some trends just to note. We do also do a survey to our consumers at the end of the enrollment process to see if they're satisfied, how their feeling is on the enrollment. And we're at this point, the end of December, we're about 76% of folks had a positive experience. So we are looking to review the feedback that they get, that folks who weren't satisfied, we're always looking to improve. So we're working on that feedback to improve that as we go forward. But still, that's a great number to get to. And again, our big number for dental is we're up over 54% numbers wise over our enrollment for last year. So that's a really big win. And we're really proud of that number for this year. Any questions? If not, like James said, we will have more information at the board meeting next week, as well as a fuller report next month. Thank you.
That's great. Thank you. Any questions or reflections? Well, thank you so much. Thank you so much, James, for this update. This is great.
So, Mr. Chairman, thank you very much. Again, this is the first discussion public discussion we are having about what the next five to 10 years could or should look like for Access Health. I do want to talk a little bit about where we've been. For the first 10 years, 10 years ago, this upcoming October 1st, 2013, Access Health opened its doors for operations. So 10 years ago, so we are celebrating our 10th anniversary. And back then, the strategy was, let's just get the system working. Let's just open the doors and make sure it worked. Fortunately, we were among a handful of states that were successful in doing that. And we were recognized and continue to be recognized as one of the best exchanges in the country. But that success was pure grit and hard work on our employees that were focused on one thing only. October 1, 2013, let's make sure our operations, call center, as well as our system was working. So we weren't thinking 10 years, big picture. We were just making sure that everything is working. Now, after 10 years of operations, we have far more information than we had back then. Because back then we were just creating things and we were flying in the moment. We have much more information than we had back then. We, the board, have defined a mission for us. Our mission, as stated, is that we will continue to lower the uninsured and help address health disparities. That is our core mission. So everything we do going forward will that's what will guide us. Having said that, Connecticut continues to be one of the healthiest states in the country. However, have the highest health disparities in the country as well. So while we've been very successful in getting people access to health insurance, but we continue to lag most of the rest of the country in terms of addressing health disparities. All right, and you will hear more about the subsidiary in a few minutes. But when we are researching for the subsidiary, the ALICE data we looked at indicated to us that in the last decade, the working poor families in Connecticut grew by 40%, while the population grew by 2% in the same decade. So that's indicated that the growth is organic. We're not bringing people from the outside to make us poor. Our current population is just getting poor. So the question is, what can we do? And we do know that poverty is one of the biggest drivers of health disparities, as well as families and individuals not having health insurance. So the next 10 years, so we have to look at our strategic focus for the next 5 to 10 years to help us address some of the structural drivers of the uninsured, as well as the as well as the health disparities in Connecticut. So with that, I just want to give you a framework of what's going to drive us, our core mission. And we have to be innovative, creative, and bold at how we have to address some of the structural drivers of health disparities and keeping the uninsured where it's at now. Although we have cut it down by more than half since we started, But right now, the last data I've seen, we are about 5.4, 5.5, and that is still far too high for the state of Connecticut, especially a state as wealthy as we are, as educated as we are, as healthy as we are. So we have some more work to do in that space. And then again, after 10 years, we know what we have to do. We just got to come up with more creative and different approaches to get there. Right. So we know at our core, we know what we have to do. We know how to get people enrolled. We know how to do outreach. We know how to do very targeted outreach. Now, question is, what more can we do to drive these numbers lower? So that's the framework that we are. That's in our thought process while we are moving forward. Now, I've invited Kara Mitchell, who's a principal with Minton Hoke, our marketing firm, and I've asked her because she's going to be working with us as we develop our strategic initiative. I'm going to ask her to give you an overview of what we are looking at. I know she has reached out to all of you to schedule meetings as we look to get this committee's input, the thoughts and ideas about what the next 10 years should look like. And that'll drive the leadership team as we develop the framework for the next 10 years. Please welcome Kara Mitchell. Kara?
Good afternoon, everyone. Thank you, James. And I think perfectly stated, as I've mentioned in many conversations with all of you over the last week or so, this is an open dialogue. And one of the things that we said to James as we were approaching this process together was we have to bring an external viewpoint to the table. It's critical that we don't try to create the strategic plan just in a vacuum. And so all of the perspectives that are shared in our conversations over the course of the next week or two, as we have different sessions together, we want to make sure that we bring those forward with the SLT, the leadership of Access Health, and we will be moving forward in a few sessions with them to build what we call a shared viewpoint moving forward. So how do we take that external perspective and the perceptions that exist, and some of the internal desires, perceptions, and plans, and start to bring that shared viewpoint forward. And I think, as James stated, just looking forward, 10 years is lofty. If we could all see into a glass of what 10 years will look like, that would be wonderful. But it means just focusing on more big picture thinking, more innovation. So trying to keep open minds. I do have a framework for the discussions roughly that I can share in advance. I think some of you might have expressed an interest in that in the conversations that we've had so far in setting up the meeting. So happy to share some perspective on that so that you have some time to think about the questions and answers going into the conversations. But again, just open dialogue is really what we're looking for here, so that we're bringing all perspectives forward and making sure we're considering that as we build out this plan.
Kara, thank you very much. A couple of the thoughts that I have also in the context of this discussion is that 10 years ago, the world was a far different place. Healthcare was different than it is now. And when you think about the last 3 or 4 years, the disruption that has been in the workplace because of COVID and the economic impact that has had on Connecticut residents, we are, by force, by choice, we have to come up with a very innovative, creative way to manage Access Health resources, limited resources, with the focus of increasing revenues going forward, to minimize the impact on premiums going forward, so that assessments do not need to go up. As well, we have to look at our staffing needs, our organization, because the workforce have been so disrupted, not just for Access Health, but across the entire country, the economy. So now we have to look at how do we hire employees, how do we manage our employees, and these are all strategic thought process that we will be going through as we move forward. So again, the last 2 or 3 years have been very impactful in terms of the massive changes that has gone across the entire country. But when we flipped the switch on October 1, 2013, when you compare that to where we are today, the far different environment, not just in terms of the healthcare and health insurance workplace, but just the entire economy, the workforce, and what we have to do. We have to look at what we do differently and come up with new avenues, new approaches to continue to be impactful in helping Connecticut residents to improve their quality of life. Thank you, Mr. Chairman. If you have any questions at all, we're happy to answer them. Again, this is just a starting point, so we have a lot more work to do. We just want to give the committee an overview of what our thoughts are. And I know we will be meeting with each committee member over the next several weeks to get your input. And after that, we'll come back with a very high, with a summary of all the inputs. Then we maybe at that point we have a really very in-depth discussion about what the path forward looks like.
Thank you, James. Thank you, and thank you, Kara. You know, the fact that we are among the healthiest in the country, and at the same time have among the sharpest disparities in the country, says to us that we know what to do, we know why to do it when it comes to access, health, and healthiness, but we haven't addressed that same old disparity question, and we have to continually recommit to closing these gaps. This is a resource issue. It's not that we don't know how to do it or what to do about health access. So thank you for highlighting that for us, and we look forward to working with you, Kara. Any comments, questions, or observations from any of our other members? Thank you all, and thank you again, James and Kara. We look forward to our continuing conversation.
Thank you, Mr. Chairman. So we have a couple of updates. We have one on Broker Academy. Then we'll close with an update on where we are with the subsidiary. Tammy.
All right. Good afternoon, everyone. Tammy Hendricks, Access Health Connecticut. I hope your new year is off to a great start. And as we often do, our teams hit the ground running this year to launch the Broker Academy Year 2. So really excited to welcome another class. And this year, we think will be even better than last year based on all of the new changes we've implemented. So to recap, our first class graduated in October. Most, if not all, the students really continue to stay in contact with their mentors throughout the open enrollment period so far. My outreach team, we've also had the students enrolling at our in-person fairs, which has been great for them to get that experience with the consumers face-to-face. So now they'll be transitioned to our internal broker support team to continue to give them that the help that they need. So we want to make sure we're a part of this journey for them. We don't want to just throw them out there. So they'll get their questions answered, any concerns, they can go to the broker support team, and we'll try our best to help them along. So as we wrapped up last year, we had a lessons learned session, which was really important. It had all of the staff that was involved in the project from the beginning. So I believe there was about 30 of us. And we went through every part of the project. This was, I think we were there for 3 or 4 hours. We talked about what went right, what needed improvements. We compiled all of those suggestions and feedbacks, and then we started to plan for year 2. So a few key details for year 2. This year, we plan on having 2 classes in Hartford and New Haven. Those 2 locations happen to have the largest number of applicants and students last year. So we're working on confirming where the actual locations will be in Hartford and New Haven, but that is the plan and more to come on that. The target is still to accept up to 100 students. The program gained a lot of traction last year, so we're expecting a really great pool of applicants this year. We're really excited about it. Many people have reached out to us. They missed the application process last year and they intend to apply this year. So we're really looking forward to that. We also updated the Broker Academy webpage, which will launch tomorrow. It came out even better than we all could have imagined. More details. Of course, we have the luxury this year of looking back at what dates and times worked last year. So we're able to give the students a full timeline this year as they look to apply, and so they know what to expect. So the page will be live tomorrow, but the application will not be open until the end of February next month. So we shortened the application timeframe by just a few weeks compared to last year. Last year, I think we opened the applications at the end of January. So we shortened it by a couple weeks, but that's really important because we want to keep the folks that applied engaged. So we think a shorter window will help that. So the applications will close at the end of March. The team will review and accept the students. And the goal is to have all the students accepted by May. Then we can have the pre-training courses with them before the actual in-person class. And that was one of our biggest success last year, keeping them engaged during that time frame of getting accepted and starting class, but also teaching them about Access Health, the different departments, what they can expect from the in-person classes. They can meet the Kaplan instructors, which went really great. And we also had a broker come on to talk about being a broker, and the students really responded well to that. So really important that we give them that opportunity that month to learn about Access Health, learn more about the program before they actually start. So that is the plan for now. We are on target with all of the dates that we have outlined, and there will be more information on the webpage once it goes live. And that's really all I have for updates. James, did I miss anything?
No, it's very quickly, just Mr. Chairman, what we will do once we have all our ducks in a row, we're ready to open the doors, we will forward the information to the board, all board members with links so that they could forward it to their network, encourage people to apply.
Thank you. I see we have a question from Ted.
Thank you, Mr. Chairman. Quick question. Thanks for the great summary there, Tammy. Do we know how many policies our first class was able to execute on?
So how many enrollments?
Right.
We can get those numbers. I believe the broker support team can gather those numbers. So that's something we can work on, but we don't have that number right now.
Okay,
we can certainly get that.
So Ted, as you know, Ted, most of the broker academy was funded by grants, and we have some targets, we have some goals, and so we are tracking that. Once we're going to track that for the entire year. Once open enrollment closes, then we'll go back and see where we ended up. Most of these new brokers are learning now because we pair them up with the mentors, and so in some cases the mentor is the one who's getting the credit of record, while the mentee, the new broker, may have done most of the work because they're learning. So again, we will track that information, report it back to the board, hopefully at the February board meeting.
Would we be tracking that on into next year when they're more seasoned performers?
Yes, we will. We will.
Right.
Again, for the grants that we receive, we are required to track that and report back to them.
Great, thank you.
Thanks so much.
Thank you. Any other questions or observations? Thank you. Thank you for that great update. You know, the Broker Academy is such a great model. It's such a great multi-generational success model, community focused and based, and it's so replicable. So I'm just really excited about what you're doing here, and I hope folks are watching in other industries and other entry points for helping lift up community. Thank you, James.
Thank you very much.
So, Mr. Chairman, the final discussion we have is the subsidiary update and where we are. We are getting very close to the rubber hitting the road. So it's getting close. So we will have a lot more information for the strategy committee to read and discuss. We do have a final draft of the business plan that we will forward to the entire committee after this meeting. But I'm going to have Susan reach out to give you an update on where we are and what the next steps look like.
Thank you, James, and thank you, everybody. As James mentioned, a lot of work has gone into the business plan, and actually Kara Mitchell, who's on this call, and Vincent Hoke has been extremely instrumental in helping us get to this final phase. And a lot of information is incorporated in the business plan. We've got listed here the development of the finance model that the finance team at Access Health has worked on very closely, the multi-year finance model, and I know that information is in the report. And also very key is a customer assessment. You know, we know sort of the populations that we want to help serve and health equity, and really assessing the need. And James did mention some of those data points that we've been looking at, and looking at the populations in Connecticut that we hope to serve. So that is all incorporated in there as well, which is very important to the work that we're going to do going forward with the subsidiary. So for this next phase right now, James is working on meeting with all of the board members, and he'll be doing that this month and next month, I think, going around individually and meeting with all the board members about the business plan and our plan to go forward with the subsidiary. And then we've also done work on our end about a name for the subsidiary, and so we'll be registering and trademarking that name and reserving the URL. So we have that. And then the next step after that will be presenting the business plan to the full board for the board ultimately to adopt a resolution for us to create the subsidiary. And then once that resolution is adopted, we will file, and incorporate the entity, and then work on 501c3 status we've talked about, so that the subsidiary can apply for grants to help in funding as part of the finance model. So we've got all those key steps ready to go. So, now really is the time for James to meet with everybody and get them up to speed on where we are. And then next step would be probably for late spring, would be to present the whole plan to the full board at a board meeting.
And Mr. Chairman, this is after a thorough review and input from this committee. Again, our preference is that this committee would refer a positive referral to the board. But again, we're not going to do anything with the board until this committee has approved the business plan going forward. So a lot more discussions to have with this committee, and to go into the weeds, the details of the business plan, to answer any questions so everyone's comfortable with it going forward. Again, I just want to reemphasize what I said earlier during my opening comments, that everything we do is with the focus of lowering the uninsured and helping to address health disparities. And the subsidiary, as the state legislature authorized us to create one, is to come up with innovative approaches to help meet the objective they set forth for us, which was to lower the uninsured, because they know we had a number of limitations by the ACA, stuff that we cannot do in our current structure.
Thank you, James. Part of why the reason that this is so exciting is because, as you know, and I'm sure this is part of your planning, it aligns very closely with some of the legislative prerogatives that have already been stated by this government and by this legislature moving into this funding season, and how it is that we'll work to cover populations that are difficult to cover because of the rules in place or laws in place, or just the structure that is immovable. So this is to give us that flexibility. So I hope that we can have an open discussion about what that looks like and how we're aligning with other efforts across the state that will leverage this.
So thank you, Mr. Chairman. One of the areas, as you indicated, the undocumented population in Connecticut, how do we help them get access, but also make it affordable for them? The 501c3 will allow afforders to apply for grants, which can help to to absorb some of the premium costs, make it more affordable for them to buy health insurance to Access Health. That's just one minor example. There's something we cannot do in our current structure that we'll be able to do to the subsidiary. And we also have other ideas and thoughts also to help drive people to the subsidiary, and by offering a number of benefits free of charge, because grants the grants would help us to afford to give them good benefits at no cost to them.
Great. That's good. I see that Matt has raised his hand.
Thanks. I know this is my first meeting, so I don't know sort of what the committee in the past has sort of given authorization to or green lights to, but I do, to the chair's point, I do think it is additional conversation is necessary to think about how this aligns with other efforts that are actually already in place by the state of Connecticut. That, as folks know, I've got concerns about duplication of services. The other question I have here is on this to-do list, because this has got to still be approved by the full board of directors, correct?
Correct.
So I don't know that I understand the purpose or the authority to register the name, trademark, URL, all that stuff, unless the board actually gives approval.
Sure, Susan, can you talk about that?
Sure. So we would seek to register a name, and get the process going, because it does take a little while, so that we don't lose out on, a name that we would like to use. The name will be used when we file to incorporate with the state. But this would be to register the name, which can always be withdrawn, but to not lose out on a name, on a possibility of a name.
So Matt, we have selected the name for the subsidiary. We just want to lock it in so that when the board approves the subsidiary, and we go to file to incorporate with the state, so that the name is available.
But you can recognize how I'd be frustrated as a board member at the fact that there's been a decision to register a name for an entity that I have not, as a board member, approved. Like, that isn't, like, I actually kind of find that insulting as a board member of Access Health.
Oh, well, that certainly was not our intent. The intent was we're trying to get ahead of the curve. If the board doesn't approve this.
I don't want you to get ahead of the curve. I want you to follow the curve, which is following the lead of the board, which hasn't yet voted on this. Like, that's where I get offended. Don't get ahead of the curve. Like, where the board is the curve.
A clarifying question, Susan. Does the registration of the name and the trademarking, does that put us under any legal obligation?
No, it's marking out your desire to use that name, and protect it for yourself so no one else, has it in the space. But as I said, it could be withdrawn, and obviously it's nothing official as far as the entity itself, Matt, would not be formed until after, the board had adopted the resolution. This is just to try to preserve, the possibility of that name.
And
if you will.
Has the board voted on the name?
No.
Okay.
So to Matt's point, this would be a proposal, right? And it would be presented as a proposal to the full board?
For the resolution, yes. To form the subsidiary. That is what's required under the legislation that permits us, that James has mentioned, that permits us to form legal subsidiaries, that the process is that the board adopts a resolution for the formation of the subsidiary.
I'm just not sure it's
go ahead,
like, I'm just not sure it's the idea of registering to me is putting the cart before the horse.
May I ask, the registration process and the other preliminary steps you're thinking of taking, What is the cost associated with those? How much resources would go into that? Is it minimal or is it substantial?
No, I think I don't know the exact amount, Ted, and I can look into that and send that to the committee, but it's fairly minimal. It's not a big cost to register a name.
So it's like less than $1,000 or something?
Yeah,
or-
I believe so.
I think one of the risks, maybe as I think about it, might be some URL or name pirating that we want to avoid by being too clear about the name before we register it. But I also want to make sure that we're very clear in our language, right? In terms of a proposal, a robust discussion, ensuring that there isn't duplication, noting where there may be overlap, where we may be leveraging, and where this is an innovation, so that we're covering some of the questions that Matt is raising. Because, there's the question of course, leveraging what we're doing in other parts of the state, but we don't want to reinvent a wheel or duplicate an effort. And I think it's very clear that it should be very clear to the voting members and also to the public that we have an eye for that.
Absolutely. Matt, one of the reasons that we're using this approach, when Access Health was first created, we had a lot of issues with URLs and other names. So the minute we were created, Access Health Connecticut was created, a lot of folks out there purchase the URLs. So right now, if you Google Access Health, you have accesshealthct.org, Access Health, a lot of Access Health out there where our customers get really confused because a lot of people they pirate them, then they try to sell them to you after the fact. That's why when I say we try to get ahead of it, that's what we're trying to avoid. But there was no intent at all on our part to get ahead of the board. We're just trying to think, what are the steps we could take right now to avoid confusion for our customers as we continue to see to this very day. Again, if you Google Access Health CT right now, you may get a list of a number of Access Health .edu.org, because we didn't buy them, because we didn't know at the time, 10 years ago, we didn't know that that people were out there doing that. So that's what drove the thought process. Nothing else other than that. Trying to get ahead of people out there who, once the board vote on the new name and everything else, and everything else, then just right then and there start registering or buying those names. And if we want to use them, then we got to pay them. That's what drove this.
I get that, but as you just said, James, the board needs to vote on the name.
Right.
So I don't think it's appropriate for the staff to go and buy a name and a URL that the board hasn't voted on.
If this committee wishes, we could go back and relook at that. But if the board approves the name, approves the subsidiary with the name, then this just kind of gives a little exposure out in that space.
Is there a way, James, for us to have an executive type session? I don't know how this would work procedurally, but an executive type session with the full board where we could discuss intellectual property and preliminary registration of certain types of intellectual property, so that we can both avoid some of these issues that you're describing, James, but also honor the input of the full board on some of these nuanced issues, like a name of an organization, which of course is, this is the face of our state. So it is important that the subsidiary, it's important that Access Health as a whole have input on this. So is there a way to do that legally?
I would have to check the FOIA statutes, Steve, to just see there are exceptions. Generally, the board and the committees are to meet public, and there are certain exceptions. So I would just have to check the exceptions to see if that would fit under one of those.
And this would be it's a question about intellectual property and the sort of the legal requirements and the legal perils around it. So I don't know if that is anything that we can look at more precisely. I saw that Paul Lombardo had his hand up, and then you disappeared, Paul. I'm sorry.
No, Stephen, you asked my question. That was going to be my question. If there was a way for the board to vote in a confidential manner so that the name that had been agreed to and voted in by the board would not be accessible to the public until Access Health CT actually went through the process of registering it, to try to essentially get at James's point, which is we don't want to have to start paying people for the URL if it is publicly announced before they're able to register the name. So I was asking basically the same question, Stephen. Thank you.
Thank
I
you. And it's
will
a real
say,
tension.
sorry.
It's a real tension because FOIA is there, freedom of information and public access is there for a reason. And so we should be careful about what we do in private. So I really, if we were to do that, I would really want to focus it to the legal question, perhaps having the larger conversation in a public setting and honing in on the protected conversation very precisely. So that would be the only thing that I would add to that.
I do believe any votes and action the board takes has to be done in public.
So, Mr. Chairman, we will put the registration of the name, trademarking, reserving URL on hold until further discussions with the board.
Great, and maybe figuring out these procedural steps, and as we think about what that interim two-step might be, we've done this before when it comes to sensitive information. We do it when it comes to a salary increase, for instance, or a bonus increase or that sort of thing. So there is precedent for it. I just want to make sure that we're precise and we're careful. To the point of our members.
Yeah. Stephen,
go ahead.
One quick question for Susan. Susan, you mentioned that all votes have to be public by the board. Is there a way, and I think Stephen mentioned this at the beginning of this topic, is there a way to have conversations with the board in executive session, not necessarily vote on the name, have those conversations before the vote is held, even if Access Health CT has attempted to register 3 different names, it's going to cost you $3,000 instead of $1,000 for one name. And then you have those registrations, and then when the board votes on the eventual name, it's in public, but you've already bought one of the names that's been discussed as part of that. I am just trying to think outside the box without breaking a rule, to Stephen's point.
Right, absolutely. And that's what I was saying. I will look into the exceptions for what the board is permitted to have an executive session to have a discussion on. I know litigation or pending litigation is something, security. There are some things related to, limited things in the HR arena. So I just need to double check the exceptions to the Freedom of Information Act to see if there is an exception that we can fit that discussion even into. But absolutely, that's what I will check.
All right, thanks a lot.
James.
Okay, thank you, Mr. Chairman. So we will, the name registration, trademarking, URL, we're going to put that on, we're going to put pause on that until further discussion. And within the next month or so.
That's great, James. And I think, there's that niche question, right? But then there's also the bigger question, which I know that you've given thought to, but I think it bears repeating. How does this compare to other initiatives that are happening in the state? How do they align? How does it leverage? And how do we ensure that it doesn't duplicate? That's critically important. I think it's important to continue to repeat it. And if we haven't said it already, to establish it so that it's clear to the public what we're actually doing.
We will follow through on that. Again, that's been part of the development of these plans, but now we need to communicate it more effectively and repeatedly, and we will.
Anything further on this issue? Any other observations or questions? Just CEO. Oh,
Yeah. That was it.
okay, great. So unless there's anything further, I'd like to thank all of you for this robust discussion. This is exactly the sort of question and inquiry that we should be pursuing in these meetings. And I really enjoyed it. So, and thank you so much to you and your staff for your vibrant presentation. And we just look forward to continuing to work together in this way. So without anything further, I would ask that someone make a motion to adjourn.
This is Ted, so moved.
This is
Any
Grant,
second?
seconded.
Marcin, if you could do a roll call.
Sure. Ciro Hernandez,
Yes.
Grant Rader,
Yes.
Paul Philpott, Paul Lombardo,
Yes.
CC Woods, Matthew Brackman,
Yes.
and Theodore Doolittle.
Yes.
Thank you.
Thank you all. Thank you, Marcin.
Thank you all. Thank you.
Thank you, everyone. Have a great afternoon.